Today we're going to demonstrate surgical techniques for insertion of ultrasonic transmitters in fish. Underwater telemetry equipment has improved considerably in the last decade. The miniaturization of components and advanced technology has enabled the electronic experts to develop smaller transmitters that last longer and send signals farther. The signal receiving equipment, too, has improved, which makes the identification of specific signals and frequencies much easier and precise. But most of all, by using this underwater telemetry equipment, fishery scientists are able to learn things about fish that they could never do with conventional methods. Now, the latest transmitters, such as this one here, have a longevity of over 12 months. Now, to be certain that these transmitters are retained by the fish, the best place to put them is inside of the abdominal cavity. This is the thing that I'm going to demonstrate today, the procedures as to how we do the surgical insertion and the suturing of the incision. Now, before we get started on the surgical procedures, there are some preliminary steps that I believe should be known here. First of all, this is a diagram of the ventral side of a fish, and today we're using a largemouth bass, a fish with scales. There are two things that you have to be careful of. One, that you do not make the incision too close to the anal vent, down here, or too close to the pelvic girdle, which would impair the functions of the fish. So what we have to do is we have to feel to make sure that we are below the pelvic girdle and that we are anterior to the anal vent. So that gives us an area approximately of that size to work with. I like to make the incision about 1 centimeter off to the side of the midline of the fish being approximately there. I like to make the incision right in here, and that's for two reasons. One, it gives you a little bit more flesh when you suture the incision closed. And two, when the tag is inserted and it rests within the abdominal cavity, you do not have the weight or the pressure of the transmitter directly on the incision. It'll be off to the side a little bit. Okay, you got that? Now, this operation really takes very few instruments. As a matter of fact, most of the time we do this out in the field, and quite frequently it's at night. We always try to sterilize the instruments with alcohol. And we do use an antiseptic called betadine. I've done many fish without the antiseptic and have had some very good success. The tools or instruments with which are needed are a pair of serrated edged forceps. This is to pull scales. Now, if we were doing a channel catfish, you wouldn't need to do this because they have no scales. A pair of scissors that have one blunt end, because when you go in and enlarge the incision, you don't want to be cutting out any of the vital organs. A scalpel with changeable blades. Keep them very sharp, because the smoother the cut goes, the easier it is to suture it back up again. And a pair of fine-tipped hemostats to grasp your needle with when you are doing the suturing. So really all we need is 4 small instruments. The tag, the transmitter, is also bathed in alcohol. That then will be dried off before it's inserted into the fish. Again, the instruments that we use are a pair of serrated edge forceps, a fine nose hemostat to grasp the suturing needle, a pair of scissors with one round tip so we don't injure the fish in any way, and a scalpel with interchangeable blades so that we can always work with a very sharp blade. The type of sutures that we use are Ethicon silk sutures, size 3/0 with an FS1 needle. And this is a curved needle and makes it quite easy to do the suturing. This is rather thick suture material compared to some of the other operations that are done, but it's a lot easier to work with, particularly when you're out in the field and working at night. Now, before we get the fish and put them in the operating trough, I would like to point out that I do not use any anesthetic in these surgical procedures. I used to use MS-222, and we found that the trauma involved in the anesthetic seemed to be worse than that without using any at all. We have done this operation successfully out in the field during the summer, during the spring, and have released fish immediately after the suturing had been completed. So let's see if I can get this guy now. Oh, be good to me, fish. Yeah. Nice and quiet. Nice and quiet. Be ready, Jeff. I need to have a towel to dry myself off a little bit. Okay, now that we got this fish settled down, may I have the forceps, and we will remove some scales. Remember I said that we were going to go off to the side of the midline, and we want to make sure that we got behind the pelvic girdle and anterior to the anal vent. And so now, hang on to him so he doesn't jump. And we want to remove approximately 3 rows of scales the length of the incision. The incision needs to be only large enough to insert the transmitter. Now, Robin, may I have some of that disinfectant? A little bit of betadine on there. And thank you. Give me another one of those cotton balls to get rid of some of this stuff. It puts a little coat on it. I'm not sure that it's 100% necessary. Now, we have the scales removed and we're ready to make the incision. And may I have the scalpel, please? Okay, the incision made with the scalpel is towards the posterior end so that you can get the scissors in there. And you have to be very careful in making this that you only go through into the abdominal cavity and not into any of the organs. And this is always a little touchy. And sometimes I have to test it. Nope, I'm not through yet.